Good afternoon, everyone. My name is Dr. Geetpriya Kaur, and the topic of my presentation is potential impact of oral microbiome in oral and systemic diseases. Microbiome refers to a community of microbial residents in the body. This term was coined by Nobel Prize winner Laureate Joshua Lederberg. Coming back to history between microorganisms and host, the co-evolution between the microorganisms that is blue in color along with their respective hosts that are green in color have resulted in mutual adaptation and functional integration, thus leading to microorganisms that colonize on the surface of the body, basically in case of holobiont. What is holobiont? They are biological units including numerous microbial symbionts, and their genome forms holobionts. This history is backdated, that is 1.5 billion years back. Oral microbiome. Oral microbiome or oral microflora can be defined as the collective genome of microorganisms that reside in the oral cavity. What is difference between microbiome and microbiota? Microbiome is the sum of microbes, their genetic information, and the environment in which they interact. Microbiota, all living microbial organisms constituting the microbiome, forms the microbiota. Coming on to the concentration of microbiota, oral cavity forms the second highest habitat of oral microbiome with 10 raised to power 11 to 10 raised to power 12 concentration of oral microbiome, and the first one is the colon with 10 raised to power 14. Oral microbiome consists of bacteria, fungi, viruses, archaea, and protozoans. Uniqueness of oral cavity as a microbial niche. Oral cavity is the most diverse microbiome in the digestive system. It contains 700 different species of bacteria, fungi, viruses, archaea, and protozoans. Saliva contains 10 raised to power 9 commensal bacteria per milliliter. Saliva has a stable pH of 6.5 to 7. The supragingival, subgingival, interdental area, and tongue are the distinct oral regions with unique microbiota composition. These bacterial niches are exposed to saliva or gingival crevicular fluid. The oral cavity is maintained at a relatively stable temperature of 35 to 37 degrees Celsius. Basically, now in this coming review, I'll focus on the bacterial content present in the oral cavity and in case of oral diseases and the systemic diseases. So first, I will start with the abundant bacterial species which are present in different anatomical regions of the oral cavity. Like in saliva, the most prevalent is Prevotella, Veonella, Neisseria, Pasteuracea, whereas in keratinized gingiva, Streptococcus and Petrolaceae are present. In case of buccal mucosa, Streptococcus is prominent and classified Pasteuracea, Gemella, Prevotella, and Neisseria are present. In case of hard palate, Streptococcus, Venella, Prevotella, and Neisseria species are mainly present. In case of tongue, Streptococcus, Venella, Prevotella, Fusobacterium, and Neisseria species are the most prominent ones. Oral dysbiosis. What do we understand by the term dysbiosis? Dysbiosis is defined as a condition in which the normal microbiome population structure is disturbed, often through external burdens such as disease states or medications. The change in the oral environment can disrupt the relationship between host and its resident microorganisms. Thus, there is increase in the risk of the disease. The various exogenous and the endogenous factors which are responsible for dysbiosis are smoking, alcohol consumption, socioeconomic status, antibiotic use, diet, and pregnancy. Other factors which also contribute to the dysbiosis are genetic differences, activity of salivary proteins, salivary florates, innate or adaptive immune factors, oral hygiene, antibiotics or antimicrobial agents. This represents the dysbiosis model. Basically, over here, during the normal health of an individual, the majority of the bacteria have a symbiotic relationship, like you can see in the green color. This relationship is between the host and the microorganisms, where when after bacterial translocation, that is red in color, it leads to dysbiosis and thus affects the health of an individual. Basically, potential karyogenic and periodontopathic bacteria are detected at a lower levels in case of normal healthy individuals. But in case of dysbiosis, due to the factors like we have read before regarding the dysbiosis, like the smoking, diet, hygiene, all these factors can lead to dysbiosis, thus increase the disease states in which the basically there is change in the conditions and alters of the bacterial condition of the oral cavity and the oral microbiome, and which further leads to caries, periodontitis in case of oral diseases, and can even lead to the oral cancer formation. Factors now we have read in previous slides, the exogenous and the endogenous factors. But what are the benefits of symbiosis? That is the normal condition of the oral bacteria in the oral cavity. It has its own benefits. That is, it gives resistance to colonization of pathogens, supports host defense system, provides anti-inflammatory properties and antioxidant activity. And this alteration due to the external factors leads to the dysbiosis of the oral microbiome. What is the role of oral microbiome in oral diseases? The oral diseases which are mainly caused by the oral microbiome dysbiosis are caries, periodontitis, periimplantitis, mucosal diseases like recurrent aphthous ulcers, oral lichen planus, oral leukoplakia, which further leads to formation of oral cancer like oral squamous cell carcinoma. There is strong association between oral microbiome and dental caries. As we know, in caries, carbohydrates are fermented to organic acids like lactic acids, and these acids lowers the pH from 7 to 5 of the saliva, resulting in demineralization of the tooth surface. This drives the selection of effective acid producing and acid tolerating bacteria. Only during this time, many risk factors such as not sufficient time for pH neutralization due to frequent snacking, then plaque formation due to under levels of the fluoride, calcium and phosphate levels, low salivary clearance leads to demineralization, and this demineralization overweighs demineralization, thus leading to mineral loss and causes dental caries. Oral microbiome and periodontitis. As we know, dental caries, when worsens, it can further lead to the periodontitis. Periodontitis is characterized by extension of inflammation into the supporting tissues of the teeth, like it leads to the loss of bone attachment. And in this, first, these actually I have divided plaque maturation into three categories: early colonizers, middle colonizers, and late colonizers. Lee Y. et al. Into 2021 have divided microbial complexes into three categories, which shows increase in the case of periodontitis. Early colonizers are Streptococci species, Actinomycosis, Echinella, Capnocytophaga, and in middle colonizers are Prevotella intermedia, Fusobacterium nucleatum, and late colonizers are Porphyromonas gingivalis, Tannerella forsythia, and Treponema denticolum. This is the model of periodontitis pathogenesis. In case of clinical health, assume some mild inflammatory changes are present in case of normal clinical health, and there is maintenance of symbiotic relationship in case of the biofilm. Whereas when we come to gingivitis, this biofilm is accumulated with bacteria, and it as its position is not disturbed, so incipient dysbiosis occurs, and this further leads to host response which remains proportionate, and due to the maturing of the biofilm, it is associated with inflammation and does not resolve easily, and becomes chronic in nature, supporting dysbiosis. Depending on the factors like genetics, environmental, lifestyle, risk factors, some susceptible patients further progresses into periodontitis. And in case of periodontitis, there is exaggerated post-inflammatory response, which causes majority of the host tissue damage, leading to chronic destruction and inflammation. Basically, in this case, cytokines are released, prostaglandins are released, which leads to the destruction of the bone in case of periodontitis. And like we know, periodontitis is further linked with the systemic diseases also. It is one of the causes for the systemic diseases. What is link between oral microbiota and oral mucosal diseases? Oral mucosal diseases is a series of disorders or conditions affecting the oral soft tissue and mucosa. Oral mucosal diseases mainly include oral infection diseases such as ulcerative lesions like recurrent aphthous ulcers, RAU, oral candidiasis, oral potentially malignant disorders like oral lichen planus, and oral leukoplakia, oral cancers, mainly oral squamous cell carcinoma. Oral microbiota and recurrent aphthous ulcers. Recurrent aphthous ulcers are the most common form of oral mucosal ulcerative diseases. They are characterized by shallow, round, painful ulcers. In case of oral microbiota, that is from the dental plaque, E. coli and L. previola levels are increased, where streptococcus levels are reduced. In case of salivary microbiota, because some studies are conducted in saliva also to study the microbiota, as it is easily accessible and it is not expensive. So the proteobacteria and Acinetobacter johnsoni are increased, whereas Firmicutes and Streptococcus livarius levels are reduced. Coming on to oral potentially malignant disorders. What are potentially malignant disorders? They are defined as the risk of malignancy being present in a lesion or condition either during the time of initial diagnosis or at a future date. The most common locations involved are buccal mucosa, gingiva, tongue, and floor of the mouth. Potentially malignant disorders can be characterized into precancerous lesions and precancerous conditions. Precancerous lesions are benign lesions with morphologically altered tissue, which has a greater risk than normal risk of transforming into malignancy. Precancerous conditions is a disease or patient's habit that does not necessarily alter the clinical appearance of local tissues, but is associated with a greater risk than normal risk of cancer development in that tissue. Among pre-malignant lesions, we'll talk about leukoplakia. Even though there are other pre-malignant lesions like arthroplakia, PVL, OSMF, and the pre-malignant conditions will focus on lichen planus. Oral bacterial dysbiosis and oral lichen planus. Oral lichen planus is mainly affected by bacterial dysbiosis as well as the fungal dysbiosis. As we know, oral candidiasis can be an overlapping feature in case of oral lichen planus. The higher bacterial counts seen in case of oral lichen planus are C. sputigena, E. corrodens, L. crispatus, M. curtisi, P. vivia, P. gingivalis, P. intermedia, S. eglatia, S. harmolyticus, A. actinomyceticocomitans, T. forsythia, T. denticola, whereas the lower levels of streptococcus bacterial counts are found in case of oral lichen planus. There is co-occurrence of oral lichen planus and oral candidiasis. Recent studies have shown that oral microbiome is linked with oral lichen planus. Oral lichen planus patient shows lower biodiversity of oral fungal community, and the abundant genera of Candida and Aspergillus are present. Candida was positively correlated with several anaerobic and periodontopathogenic bacteria genera. What is the relationship between oral microbiota and oral leukoplakia? Oral leukoplakia is defined as a white patch or plaque that cannot be characterized clinically or histologically as any other disease. Oral leukoplakia is a pre-malignant lesion that can convert into oral squamous cell carcinoma. In case of oral microbiome, fusobacterium levels are increased in oral leukoplakia and Firmicutes levels are reduced in case of oral leukoplakia. In case of salivary microbiome, oral squamous cell carcinoma has higher concentration of phylum bacteroids and Solobacterium genus than in oral leukoplakia, where Streptococcus genus levels are raised in oral leukoplakia as compared to oral squamous cell carcinoma. Oral squamous cell carcinoma is the most common cancer of the oral cavity. The mechanisms involving specific microbiota in development of oral squamous cell carcinoma are production of toxins, loss of hormonal homeostasis, immune tolerance, induction of chronic inflammatory signals, carcinogenic metabolites. As we know that microbiome influences the pathogenesis of oral cancer, bacterium mainly involved are P. gingivalis and Fusobacterium nucleatum. P. gingivalis is responsible for production of interleukins, TNF-alpha and MMPs, and basically it is responsible for the bacterial translocation, whereas the other factors, that is genotoxic secretion and toxic metabolites, along with the host inflammatory response, which was caused by the bacterium, damages the DNA and leads to the accumulation of mutations, due to which there is unchecked proliferation of the cells and apoptosis bypasses, and thus leading to the cancer, oral cancer. Coming on to peri-implantitis, this green color is the biofilm, which is formed basically in this. There is chances of bone loss, and which is caused by Fusobacterium species, Treponema species, Aggregatibacter actinomyceticocomitans, Porphyromonas gingivalis, T. forsythia, P. intermedia, Streptococcus salivarius, Staphylococcus aureus, Neisseria, virus, and fungi. Role of oral microbiome in systemic diseases. Oral microbiome affects the systemic organs, such as if it affects the brain and the spinal cord, it can lead to neurodegenerative disorders. Heart can be affected, leading to heart diseases. Blood vessels affected due to vascular diseases. Pancreas, if affected, can lead to diabetes and pancreatic cancer. If gut is affected, can lead to gastrointestinal cancer. Joints affected in case of rheumatoid arthritis. Stomach can lead to stomach cancer, and lungs can lead to lung cancer. So any particular organ which is affected through oral microbiome can lead to their disorders. How does it impact the whole body? The impact of oral microbiome dysbiosis. As we know, in case of symbiosis, they are in their normal state. The oral bacteria are present in the normal concentration, like Mittis group of streptococci, mutants group of streptococci, streptococcus, haemophilus, Prevotella, Fusobacterium, P. gingivalis, Candida albicans, and Lactobacillus, which leads to dysbiosis. And this can affect the whole body through two mechanisms, either by bloodstream or digestive tract. Periodontal pockets are close to the bloodstream, and whereas in case of digestive tract, through alimentary dissemination, the oral microbiome reaches the digestive tract, and thus leading to inflammation, which affects the whole body. Oral dysbiosis. In this figure basically represents the different possible pathways through which bacterial translocation can take place in systemic diseases. Bacterial translocation is responsible for formation of cytokines, such as interleukins, TNF-alpha, which is further affects the bloodstream by formation of lipopolysaccharides, teichoic acid, and flagellin. And this affects the cytoplasm of the target organ, over where there is activation of inflammatory pathways such as MAPK, IKS, JAK-STAT pathways. And this further leads to dissemination of bacteria and components such as lipopolysaccharides, and further production of TNF-alpha and pro-inflammatory cytokines, leading to low-grade systemic inflammation and thus leading to systemic diseases. What is association between the oral and gut microbiota? How are they interrelated? Due to the poor oral hygiene and poor quality and quantity of saliva, Dietary factors and smoking can lead to oral dysbiosis, that is alteration of oral microbiota, which further leads to dysbiosis, that is alteration in the gut microbial component. This alteration in the gut microbial component can lead to liver cirrhosis, colon cancer, inflammatory bowel disease, obesity, rheumatoid arthritis, and diabetes. These leads to the systemic diseases. The gut can be affected by three mechanisms mainly. In this, there is invasion of intestinal tract through esophagus. Then Fusobacterium nucleatum colonizes, and in case of colorectal cancer, it is evident by blood cycling route, whereas the third route is formation of metabolites of oral microbiota, which enter the bloodstream and systemic circulation, leading to human body in low-grade inflammation. What is association of oral bacteria dysbiosis and systemic diseases? How are they interrelated? These are the principal oral pathogens, main bacteria which are affected in case of systemic diseases. The blue colors are the gram positive and the red color is gram negative. Solobacterium and the streptococcus, these are the gram positive bacteria which affect metabolic disease and oral mucosal diseases, along with cardiovascular, COPD, autism, and diseases. Fusobacterium, Treponema, Agricobacter, Campylobacter, Marozilla, Capnocytophaga, Haemophilus, Vionella, Tenerella, Prevotella, and Porphyromonas, they affect metabolic diseases, cardiovascular diseases, COPD, rheumatoid arthritis, adverse pregnancy outcomes, Alzheimer's, and inflammatory bowel disease. There is association between the oral bacteria and some of the systemic diseases are mentioned here too. There is upper arrow represents abundant oral bacteria and the lower arrow represents reduced oral bacteria. In case of colon cancer, Fusobacterium nucleatum levels are increased, which are transferred from mouth to gut. In case of pancreatic cancer, there is increased levels of Helicobacter pylori, P. gingivalis, Actinobacillus. In case of liver disease, there is reduction of Haemophilus, Streptococcus, and Pseudomonas, and there is increase in Clostridium, Oribacterium, Actinomyces, and Campylobacter. Whereas in case of diabetes, there is increase of Streptococcus, Actinomyces, and Neisseria, and decrease in Bifidobacterium and Eubacterium. In case of obesity, there is increase in Plasmodium and Streptococcus mutans, and there is reduction in Haemophilus, Corynebacterium, Coronophilic phage, and Staphylococcus. Oral microbiome dysbiosis can be related to rheumatic diseases such as rheumatoid arthritis, Sjogren syndrome, and systemic lupus erythematosus. All these are the autoimmune diseases. Basically, in this, body's immunity hampers itself. In case of rheumatoid arthritis, P. gingivitis, that is Porphyromonas gingivitis, plays a major role as it is related with periodontitis and it is interlinked and it alters it further links to the rheumatoid arthritis. Sjogren syndrome is a secondary disease formation after rheumatoid arthritis. And in this, there is basically alteration in the salivary levels. There's dry mouth and dry eyes are the symptoms of Sjogren syndrome. In case of systemic lupus erythematosus, there's local oral microenvironment which may participate in the development of SLE through development of autoantibodies against oral microbial products. How are periodontitis and rheumatoid arthritis interlinked? Periodontitis is basically caused by P. gingivitis, which further release the enzyme modifying proteins, which undergoes citrullinación and leads to rheumatoid arthritis. Rheumatoid arthritis further leads to the inflammatory process, amplifies the inflammatory process, and thus leads to bone loss in case of periodontitis. Alteration of oral microbiota in rheumatoid arthritis. The blue-colored species are abundant, whereas the red-colored species are reduced. The increased species are Bionella, Otopobium, Prevotella, Leptotrichae, Lactobacillus livarius, Cryptobacterium curtum, whereas there is reduction in Porphyromonas gingivalis, Haemophilus, and Neisseria. In this article, this is from my article in which I have explained the association between oral lichen planus and rheumatoid arthritis. As we know, oral lichen planus is an autoimmune disease of the mouth, whereas rheumatoid arthritis is systemic disease. This is also autoimmune disease which involves the joints. Haemophilus species is common in both the diseases, and thus Haemophilus species is responsible for damage of the epithelial barrier and infiltration of the bloodstream by formation of lipopolysaccharides and further formation of cytokines like TNF alpha and interleukins, which activates the pathways such as MAPK, IKKS, JAK-STAT pathways, and this leads to the rheumatoid arthritis. Thus, to conclude, oral microbiome is responsible for our oral and systemic health. Oral microbiome dysbiosis, that is alteration in the normal concentration of the oral microbiome, can lead to oral infections such as caries, periodontitis, oral mucosal diseases, which further leads to formation of cytokines and TNF alpha and interleukins, which further leads to diabetes, rheumatoid arthritis, and cardiovascular disease. Whereas this oral bacteria in ectopic colonization of bacteria such as Streptococcus mutans, Fusobacterium nucleatum, Porphyromonas gingivalis, Streptococcus sanguis leads to formation of cancer, Alzheimer's, inflammatory bowel disease, and the organs involved are gut, heart, blood, brain, joint. Oral microbiome dysbiosis can be altered in case of periodontitis, like we have read in previous study, P. gingivalis, T. forsythia, Treponema denticola plays a major role. In case of dental caries, Streptococcus mutans, Lactobacillus, Streptococcus flavarius plays the major role. In case of oral lichen planus, Echinella, Prevotella intermedia are the main species involved. Oral cancer, again, P. gingivalis and Streptococcus are the main species. Autoimmune diseases, in that case, rheumatoid arthritis, P. gingivalis again plays a major role. Sjogren syndrome, Firmicutes plays a major role. Systemic lupus erythematosus, actinomyces, prevotella, and Pseudomonas species are important. And in case of cardiovascular disease, Porphyromonas gingivitis, Streptococcus sanguineus plays a major role. In diabetes, Porphyromonas gingivitis and Nandrella forsythia levels are increased. Systemic malignancies like GI cancer, Porphyromonas gingivalis, T. forsythia, Neisseria species, Streptococcus, Fusobacterium, Lactobacillus play major role. And in case of lung cancer, Capnocytophaga and Vionella plays the major role. Basically, alteration of these species, either their levels are increased or decreased, they affect the systemic inflammation and they are responsible for systemic diseases. There's alteration of oral microbiota, and these species are common to our gut microbiota also. So to conclude, oral microbiota can act as a biomarker, diagnostic, prognostic, and therapeutic tool for systemic and oral diseases. And the factors which are responsible for the dysbiosis are lifestyle, stress, poor nutrition, drugs, and genetics. And basically, the diagnostic tools which can be commonly accessible are bacterial culture, taxonomic analysis, metabolic analysis, biological analysis. As we know that metabolites are interrelated with the enzymes, and these enzymes are interrelated with the microbiota. All the three factors are interconnected, and thus I would suggest let's focus on the microbiota and consider it as a very important part of our body, and we have to focus on specific microbiota, specific species, and provide care accordingly to the patient for the individual diseases. The therapeutic tools are prebiotics or the probiotics. Prebiotics is alteration in the diet. Like the patient should include more of the salads, as prebiotics can basically enhance the system. Probiotics are individual monotherapies. Individual bacteria are mainly involved, like lactobacilli are given through probiotics. Antimicrobial peptides or vaccines are provided for a particular bacteria in case of systemic diseases. Drugs such as antimicrobial disease drugs antibiotics are provided. Thus, it is so important to take care of our oral health. Our oral health is related with our gut health, and gut health can lead to systemic diseases. Oral diseases can lead to systemic diseases. All these patterns are interlinked and are very important. So I would like to finish my presentation with on a note that we should read in detail about the specific bacteria which are related to specific disease and target those bacteria for the therapy of individual disease, either oral diseases or the systemic diseases. These are the references. Thank, thank you for your patient listening.